Good afternoon. My name is Shamia Wilson. I am a student at Winston State. I am in the process of obtaining my RN and BSN. I am going to perform a thoracic and lung assessment on my lovely daughter, Mackenzie here, and she is ecstatic to help mommy perform this assessment. Mackenzie, you do know that I'm going to post this to the internet, to YouTube, for my teacher to assess me doing this assessment on you. And are you okay with that? Great. She is okay with that. So we're going to proceed by vital signs. Reviewing vital signs. Her blood pressure was good. Temperature 98.6. Heart rate in the 80s. And her O2 saturations were at 98% room air. Great. Looks good. She is 4 feet tall and weighs 97 pounds. My baby is growing up. She is 9 years old. She does have a history of asthma. However, she is on a medication regimen of Claritin and albuterol as needed. She is not exposed to any secondhand smoke at home. She knows how to use her inhaler if there is an emergency and she needs it. Is there any other complaints? We do have some allergies to grass, mold, dust, let's see, some dandruff, pet dandruff, which we do our best to avoid at all times. Has not been hospitalized, is caught up on her vaccinations. So we're headed in a good direction on managing and controlling asthma. At the moment, she does not have any complaints. Anything to complain about, do you? All right, everything seems to be going good. So I am going to start my assessment by just observing her. I'm going to look to see if it looks as if she's struggling to breathe. Note if she's using any accessory muscles, if she's able to sit upright and actually support her arms without having to lean or lap over and support her arms on her legs, which could be a sign of struggling or labored breathing. I'm also going to take an assessment and just look at the configuration of her thoracic cavity. This can help, us indicate if there is any complications or if a patient is struggling breathing. We would notice that through labored breathing and the use of accessory muscles. However, Mackenzie looks great today and she does not seem to be struggling to breathe or have any noises or wheezing that I can hear as of right now. So I'm going to start by, as I said, assessing, and then I will move on to palpating and just checking to make sure everything is symmetrical. I will start by placing both of my hands. I'm going to place both of my hands on your back, close to the T9 and T10 areas of her vertebrae. I'm going to take both palms of my hand and I'm going to take my thumbs and push them medially, just slightly pinching up a fold of skin. And I'm going to ask Mackenzie to take a deep breath in, and we will note the symmetry of my hand expansion during her chest expansion with her breathing in. Well, Mackenzie, can you take in a deep breath for me, please? And blow out. Perfect. And as I could see that everything was symmetrical when she took in a deep breath, my hands did slightly separate, and it did separate evenly, which means she's had symmetrical chest expansion. Next, I will move on to percussion. This is done by taking your non-dominant hand, placing your non-dominant middle finger, and striking it with the middle finger of your dominant hand. And what this is going to do is help us check to see if there are any areas of consolidation or any areas of dullness, which could indicate some lung consolidation or compromise. Okay, Mackenzie, I'm going to place my hands on areas of your back and you'll feel a little thump, okay? It's important to note that the scapula, if percussed, will give off a dull sound, which is expected since it is a bone. So you want to take that into consideration so that you don't get any false indications of some problems there. Next, I will check the tactile fermenters. And by checking this, we will be able to determine, well, basically tactile fermenters is produced when there is vibration indicated when there's sound transferred from the bronchioles through the lungs and to the chest wall. And those vibrations can be palpated by placing the palm on the areas of the back, with the patient repeating the phrase 99. Okay, Mackenzie, I want you to say 99 over and over, and I'm going to be placing my hand on your back in different areas, okay? Okay, baby, go ahead and say it. 99, all right, great. Sounds good. What tactile fermenters will help us assess is that, well, there will be a decrease in fermenters if there is any indications of pleural effusion, brachial obstructions, or pneumothorax. And there will also be an increase in fermenters if there is some lung compression or consolidation. So it can be helpful in helping assess early signs of those problems. What you will notice is that most of the prominent sounds assessed will be between the scapula and the sternum. All right. So what we'll do then is listen to her breath sounds posteriorly, and then we'll move to the anterior part of the chest. All right. What you want to do when you're auscultating breath sounds is ensure that you do not pick up any background noise, such as the television, maybe other noise, other people talking. Chest hair can also interfere and make there be an extra noise picked up on the stethoscope. So you want to keep that in mind when auscultating breath sounds. And what we'll do is start up top and work our way all the way down, listening to the lungs throughout. And you want to be sure to listen through each area through one respiration. Okay. I want you to take a slightly deep breath and blow out. Okay. And not too deep. Don't want you to hyperventilate. Okay. Good job. Okay. Good job. And Mackenzie's breath sounds are clear. They sound well and even throughout all lung spaces. I do not see anything to be concerned about today. So with that being said, we will move on to the anterior part of the chest and finish up this assessment. All right, well, starting anteriorly, I will assess Mackenzie's facial expressions. I will also note her skin color, Look for any signs of cyanosis, any signs of struggling to breathe, shortness of breath, alterations in level of consciousness. Just anything that I know is related or in indication of any respiratory problems. I will also note the shape and configuration of Mackenzie's anterior chest wall to make sure that it doesn't look like she's had a history of struggling to breathe. We know that can cause patients to have a barrel-shaped chest. Although she's very young, I don't think that would show up if she was having those problems. So what I'm going to start by doing is making sure that her chest expansion is symmetrical. And I will do that by assessing, watching her now. And I can also further assess this by, all right, baby, sit up, by taking both hands, placing them here, right below, towards her xiphoid process. And Mackenzie taking a deep breath. All right, and blow out. And what we do there is note if the expansion of the chest is symmetrical by looking at the placement of the thumbs of your hands as you place those under her chest. So if the hands do separate equally, then we know that we do have equal chest expansion. Okay. Next, I will check for vocal fermentous blushing. And what we'll do there is the same as we did for the posterior chest. I will have you repeat 99 while I place my hand in different areas on the front of your chest, okay? All right, so we're going to proceed with the anterior vocal fermentous assessment. All right, can you say 99 for me? Feels good. No areas to be concerned about. With females, of course, she's a young lady, so she doesn't have as much breast as an adult female may have. So with females, you want to ensure that if the breasts are large or in the way, that you push them to the side so that you can successfully feel the vibrations from the chest wall and not have anything blocking that assessment. Okay. Next, we will move on to the percussion of the anterior chest wall. And like I've said before, percussion can help us indicate if there's any areas of consolidation or any areas of abnormal density of the lungs. Things that can cause abnormal density of the lungs include pneumonia, bless you, atelectasis, and pleural effusion. Okay, so I'm going to start by once again taking the middle finger of my non-dominant hand and striking it with the middle finger of my dominant hand. Okay. Okay, so looks good. Everything looks normal there. Then I can move on to auscultating her anterior breath sounds. Okay, so I'm just going to take a listen. You don't have to breathe too fast, but taking some deep breaths. Okay. All right. Good. Mackenzie sounds excellent. Her breath sounds are clear and equal bilaterally. There are no indications of any problems, any consolidation, wheezing, or anything today. So you check out good, baby girl. Um, as far as I'm concerned, you're as healthy as can be. Let's be proud of that. Be fine. All right. Thank you, Mackenzie, for helping mommy. And thank you. I hope you enjoyed the video.